B-Bad and Brandon.
With the lovely Melbourne back there.
Yeah, that's it. We're in at Amy Park, so you can kind of just see one of the MCG lights in the background, or maybe my head's in the way, but yeah, kind of in the based around where the Storm are, the Victory, Collingwood, Tennis Australia. It's the hub of kind of sport around here, which is good.
Damn, that's cool.
Fuck, that is actually like
That's
some of the
cool.
biggest teams.
Yeah, no,
Australia.
just a little name dropping. Mate, and Selwyn, mate, this good mate Brando. I should introduce him.
Lovely to meet you.
Nice man.
Cool. And awesome to see you and chat to you, bro. Haven't chatted to you in a long time, which is
yeah.
I was pretty pumped because I was chatting to a few of the people who used to look after. I'm still coaching today, and they still remember you, and they all say, "Fuck, he was like the best we've ever seen."
A long time ago, but
and that still stands today, bro.
Try to not so much anymore. I don't really get to use the manual skills as much anymore. So, but yeah, still try and like to think that I'd have the skill set if asked to apply it, but not having to do it at the moment.
I will always have, what would be the right word to say? Fond? No. Painful memories of what you would do with needles. And my
Oh, fuck that.
It was fucked, and you didn't care.
Yeah.
I can handle most needles, but in the hamstring, no.
Yeah, I had like a super tight one from a wrecked lower back, and it just wouldn't give out, and you would just annihilate it.
Yeah,
you hated it, and you wanted it to do what it's supposed to.
Look at the smile he's got now. He's like, yeah, I fucking remember those.
I reckon most people like soleus and calves are the other bad one. But you kind of hamstrings and through the lateral glute, definitely any form of needles, you get a good twitch response, and doesn't matter who you are, that'll send shudders down your spine.
Good twitch response. I definitely had a good twitch response.
I haven't had a needle in my calf yet, and I would like to keep it that way.
Yeah, no, I'd recommend that definitely.
Damn, bro, man. We'll make it a little bit official, and what we like to do is ask you one question, and that question is 21 sounds, who you are, and what you do. All sounds are included and counted. That includes Words, yes. Sometimes you forget to add words.
You do all the
time. Laughing, burping, whistling, etc.
Any sound.
Brando will count them and keep you accountable.
And Brando will count them really poorly.
Oh, very good. Very good. Well, Selwyn Griffith, currently head of strength and conditioning at the Melbourne Demons Football Club in the AFL. Osteopath by trade initially, and now performance and rehabilitation coach.
Bam. That was about 31, but
a real good 31.
It was a real good 31, and it really flowed. Like usually our guests get quite nervous or anxious, but you have practiced that one. Is that your elevator pitch?
No. I think my elevator pitch, I add a little bit more spunk to it, but you just want to get down to business.
Yeah, absolutely.
Absolutely.
Now, your background, you said, was osteo?
That's correct.
Could you explain to the people listening what that is? I guess osteo is not one that's most common at the moment. Like people more associate physios, chiros. Could you explain osteo a little bit?
Yeah, almost in between the physio and the chiro. So I guess when I originally studied osteopathy, relatively new or relatively unknown allied health profession. For 13 years ago now, when I graduated, relatively small population. But basically what osteopathy is manual healthcare, and it's primary manual therapy to assist people with management of pain, and return them to peak performance, whether that be in active daily living tasks or like Johnny was talking about with lifting and powerlifting and those sorts of things. So primary healthcare practitioners that are more often involved in manual therapy, but probably in the last 5 years have started to delve a little bit deeper into the exercise prescription and exercise management perspective, which has predominantly been where physiotherapy has probably been the main manual or main allied health professional in that space. And I think that physiotherapists probably get a better education initially through their degree in acute management of injuries. And so that was a gap that I guess I looked to fill following my graduation from osteopathy, because I really think that exercise therapy and strength and conditioning is the main benefit that we can have as allied health professionals in making sure that we prescribe the right exercises, that we understand exercise and strength and conditioning terminology, and that we actually educate our clients on what they can do off the table, rather than, I guess, treating the faceless person, which is pretty much the person lying head down in the table. I'm going to rub your back, rub your glutes, crack your back, and then send you on your way, and expect that, that's just going to heal someone's 2 to 3 year history of chronic back pain. I think that's what us as allied health practitioners need to understand, is how we can better educate clients and athletes on what they can do away from the table, because majority of consults last for 10 to 30 minutes. And if you think you can fix anyone in that time, you're probably kidding yourself. And it's definitely the path of education, information, and how we best use all of that to better inform people.
How did you develop that, I guess, understanding of osteo to treat, I guess, a client, athlete, or person as a whole, instead of just going, rub, crack, pop, get out? It's a very common thing, especially in the chiropractor industry. No, I'm not bagging out chiros. I know they get taught, like a churn and burn type system. How did you go through and kind of develop and see, there needs to be more?
The one of the key principles actually in osteopathy is treating the body as a whole. So from your university degree straight away, you're taught to think, from injury out rather than injury in. So we're looking at what are the other factors associated with why someone would hurt their low back, or why they have hurt their knee. And so that's, I guess, the beauty of the osteopathic education component, in that from day one you start to think outside the box, and you start to think how can hip extension strength, or how can hip range of motion impact on someone who has a low back injury, or how can thoracic mobility and thoracic range of motion impact on someone who has a low back injury. And that's great from a foundational perspective. I really feel sorry for probably some of the clients I treated in my first couple of years as an osteopath, because there's no doubt that I would have done more harm than good for some of those patients I was treating, because you don't know what you don't know. And it probably took me to start to meet guys like Johnny, meet strength and conditioning coaches, power lifters. At that stage, CrossFit was just becoming a big thing. So even meeting CrossFit coaches and starting to understand different aspects of exercise prescription and strength prescription. And that's what really probably started to improve my knowledge and understanding of how better I can resource my clients and athletes. And from then, it just basically, I did a bit of an internal audit and going, all right, well, what skill sets do I think I have that I'm really good at? And the beauty of osteopathy is from day one in university, you're taught to feel with your hands and basically understand how someone's hip moves by feeling with your hands, but then also by your clinical assessment. So I knew that my hands-on manual therapy skills and assessment were really good, but my gaps were my exercise prescription, my rehabilitation prescription, my management from acute to return to play. And pretty much I just invested in myself. So every month I'd go to a PD course, whether it was run by a physio, whether it was run by a chiro, or in the strength and conditioning realm. And for pretty much 2 to 3 years, just invested in upskilling myself in that. And, I was fortunate enough to then meet really good coaches and practitioners along the way. And sometimes those discussions with those practitioners are even more powerful than what you learn on the course, because you start to share stories about different clients, different injuries, and your philosophy, and that's what really allows you to hone your skill set. So that's kind of how I went about it. And then it was just a case of probably the clinic that I was working in at that stage on the Gold Coast didn't necessarily align with my philosophies as much in regards to how the practice was set up and the ability to provide exercise prescription and exercise even within a treatment room, just with the dynamics of how the treatment room was set up and how much space we had. So then towards the back end of my time on the Gold Coast, had the ability to work in a exercise sports and rehabilitation facility, which was known as Coyne Sports and Rehab, which Joseph Coyne ran that, who's now gone on to work with the Chinese Olympic Committee, was the head of performance at Shanghai UFC Institute, and has just stepped away from that. So, that was something that I did with him and another guy, Gavin Pratt, who's actually the head of performance at the UFC in Shanghai. And, I worked with those two guys on the Gold Coast.
Wow.
Probably 9 years ago, and just being in those sorts of environments where Coyne had a proper performance facility and then had a treatment space upstairs, and so the ability to really be at the forefront with how you're assessing and then prescribing exercise, or having a treatment block lead into then a 30-minute rehabilitation block where you'd have an hour with someone, those sorts of things. And then where Johnny and I met at QSMC, they even had a phenomenal setup in an open plan treatment area where you could be treating someone and they presented for the first time, and you'd have 12 physios around you that you could lean on for their knowledge or their expertise in that consultation straight away. So I might, assess someone's knee and go, that feels a bit different. Hey, Shane or David, can you just come have a feel of this? And so all of a sudden that collaborative approach, and they had an exercise rehab facility across the road at Aspire there when I was working there. And so then you had this collaboration with exercise physiologists and EPs. And so you pretty much create what we have at the Demons, and in elite performance, you have this interdisciplinary high performance team where you have physios, dietitians, sports scientists, S&Cs, all collaborating on developing a program. And you pretty much at QSMC, you had that same setup, just with different practitioners and laid out slightly differently for private clients. So gives them an amazing opportunity to actually have elite care, but in the public setting.
Yeah,
Fucking insane.
an unreal process to be able to look after a person who's injured or broken, for a lack of a better term, is that amateur athlete or that person who just loves to move a bit of weight or whatever their sport may be. It's no longer just a rub down and some needles. There's a whole system to look after that human, to not just manage the pain, but fix it and fix whatever caused that problem to start with, right?
Yeah, and I think that's what the general public wants now. They want to be educated, they want to be informed, and so the best clinics and the best private practices now are understanding that they need to provide better resources for clients, and that, yes, that may mean that you actually return someone from injury sooner. So technically, you're not getting as much revenue from them, but the referral component from that is unbelievable. The ability for you Johnny, to walk away and say to another coach or an athlete, I in 3 sessions, I was back to lifting my previous weights, from a low back injury, or, versus possibly not having the initial care and you having to take 2 months off lifting. And we know how important consistency of training is for strength adaptation. That can have a huge impact on someone in that strength sport field, but also the mental aspect of just allowing people to get back to what they can do. And that's the primary philosophy I have with anyone who gets injured, is don't focus on what they can't do, focus on what they can do. And so if for some reason with an injury that someone has, they can't squat for a period based on the injury, then we can still trap bar deadlift, or we can rack pull, or we can, it's about finding the solution around that problem, not just focusing on you can't squat, so just don't worry about doing that, and kind of do some hamstring curl and you'll be right. Understand what motivates that individual, understand what it is that their goals are, and you can find a way to achieve that just through a different route.
Man, I was just reflecting on that today with someone about you, and when I first met you, you probably would have been the first person I'd come across who started to think like that. It was like, you weren't like, okay, well, your back's fucking cooked, you can't squat anymore. You came up with a dozen other exercises and ways I could squat, and stuff I'd never even thought of or heard of before. But it means I could still do some squats that week and not go insane. And then, but at the same time, I haven't had that amount of time away from my sport, squatting. When I get to squat again properly, like I've still got that skill that comes with it, and the strength is still maintained, or least amount lost as possible in that process.
Because when did you guys meet?
Oh, I can't even remember.
So that would have been when I was still treating at QSMC, so probably 8 or 9 years ago. I would have said.
Just about to start. I was there when you retired me. And
yeah,
you went to the Lions completely.
Well,
and we broke up.
it was probably 7 years ago then, I reckon, because I was at the Lions for almost 10 years, and my role basically transitioned in the last 5 or 6 years. So yeah, it was probably 6 or 7 years ago.
That's like roughly around that period. Like you mentioned before, the traditional just rub your back, all right, send you on your way. It's like there was that shift in mentality of clinicians having to look at the whole picture, because, as you said before, we're in the age of information, easily accessible information. Everybody wants to know why and questioning everything. So if they can go to a trusted clinician who's going to explain why this happened, and then give them the tools to educate, not just around the injury, but themselves, in case something happens again, that's going to return tenfold than just trying to get them in again to treat the same sort of thing. But we're in that age now where people are looking for a system and a system's way of thinking.
Yeah, I couldn't agree. And I think, a lot of the conversations that Johnny I had regarding his training was, I knew that he had the knowledge to apply, the principles to it. It was just me providing a different aspect of, or you could try this movement pattern, or you could try. And so for me, it didn't come down to, you need to do 3 sets of 12 of this, and you need to do, let's do Wendler 5-3-1 for this program. It was I reckon that these movement strategies and patterns would be good for you to try, and then just start loading it. And if it feels good, go for it, and that was kind of the philosophy. So there's, you got to tweak that for different individuals. Some people, they'll need a full-on prescribed program that they can follow, each day. And then there's others that you need to understand that they have the knowledge to manipulate, and then empower them to actually do it themselves, and they'll actually get more enjoyment out of it, but they'll also start to understand their body more as well.
For you, bro, has it always been, just to go back a little bit, was it your desire to get into sports, or a specific sport, or work with players and coaches, when you were studying? Is that what you were thinking when you first kicked off?
Yeah, so, I guess when I was in year 12, I loved sport, played basketball, AFL, and, probably thought that I could try to look at that as a professional sport, but then it didn't. I probably got to a stage where I was like, no, I need a backup plan, or I need a full plan, because that wasn't necessarily the path that looked like was going to take place. And interestingly enough, my younger sister sent me a photo probably 12 months ago, and it was a newspaper clipping. So I was interviewed in year 12 from, kind of, they were asking students, where do you see yourself in 10 years or whatever? And she sent the clipping to me, and it actually said, I'll be working in professional sport, helping athletes. And I didn't remember that. I just knew that, with me, I didn't want to study physiotherapy. I kind of, and I'd had actually one of my best mates' brothers had studied osteopathy, and I'd seen osteopaths through my sporting career. And so that's what drove my interest in that. And I never thought, all right, I'll finish studying and then I'll work my way into high performance sport. I just knew that I wanted to work with athletes in some shape or form. And so when she sent me that, it was unbelievable. But yeah, I guess I've been fortunate enough to now be in the professional sports industry for 11 years or so, and AFL being the primary industry I've been involved in. But when I was on the Gold Coast before moving to Brisbane, had the joy of, I guess, working with some Ironmen and women and some triathletes. And the beauty of the Gold Coast is you do have that variety, CrossFit athletes and powerlifters, bodybuilders as well was a big clientele of mine on the Gold Coast, which, all of those people really helped shape my understanding and my knowledge early on in my career to then transition into the elite environment and see how it's done with, the Brisbane Lions and now the Melbourne Demons Football Club.
Yeah. So working with so many disciplines when you first started, that's almost a really great way to do an apprenticeship, isn't it? Seeing all of these different dynamics of sports and in what each and every one of the disciplines require. And then I imagine each one has different types of injuries or varying injuries, and that all move a little bit differently because of their training habits and what they do. It would have been an incredible way to start.
Yeah, and I spoke about the clinic I worked on the Gold Coast that after being out for a few years, it didn't necessarily align with the philosophy I had on using exercise. But in the initial period, it was unbelievable. When I moved to the Gold Coast, there was 50 osteopaths registered in the entire of Queensland.
Wow.
So that was it. And so the guy that I worked for, he had two clinics at either end of the Gold Coast, one in Robina, one in Runaway Bay. Yeah. And there were, 4 to 5 osteopaths working in the clinics, and it was chockers, because we pretty much, I think there was maybe 6 clinics, around between Runaway Bay and Robina, and he had 2 of the 6. And I reckon in my second month, he hurt his back, and he used to do yachting and he couldn't treat. Yeah. And so I took over some of his clients and treated some of his. And so I went, from a new grad where in Melbourne and Sydney, maybe you were lucky to treat, 15 to 20 people a week, and you've got to build your clientele base. Within my second month on the Gold Coast, I was seeing 60 patients a week in, week out. Like it was, and I was working long hours, but it was amazing learning because it's that baptism of fire of you need to think on the fly, you need to assess on the fly, and you need to be able to treat because someone's going to walk in, you've never seen them before, and it's like, I bent over to do my shoelaces and put my back out this morning, like I can't move. And so bang, right there, you've got to go through your case history, your clinical assessment, your diagnosis, and then treat them all within kind of 30 to 45 minutes. And then you're on to the next client. And so, and the way that he treated, like you were talking about Brando before in regards to the chiros and a bit of, he had 3 rooms running at the one time, and he had a massage therapist go in. So he'd go in, do the case history, do an assessment. Okay, yep, I understand what's going on. You've hurt your low back, but there's your hip range of motion is down, and I can tell that you got anterior hip tightness and those sorts of things. So then he'd step out, tell the massage therapist, I want you to massage their lumbar spine, glutes, hamstrings, and then he'd go into the next room and do the same thing, and he'd have the 3, and then he'd go back to the first room and then apply manipulation or, with other osteo techniques for 10 minutes and then do that again. And so you'd have 3 clients going at the same time. And so when he hurt his back, I had to do that because they're just like, he was just so booked out. So it was unbelievable. I think that week, with the massage therapist, aka the fluffer. I think I saw 120 clients in that week, and by the end of the week, I knew that wasn't how I wanted to work. It wasn't one, it didn't fit with my philosophy, but two, it's just that's a lot of it's a lot of load to put through your hands, even just like that much manual therapy and manipulation. And one of the reasons I stopped playing football actually and basketball was because I fractured my wrist when in my 3rd or 4th year of uni. So I fractured my wrist and ruptured the scapholunate ligament and broke 2 other bones and had a wrist reconstruction. And then after that got golden staph and was in hospital for 10 days and kind of, so ever since then I've never played football or basketball again because my
money makers, baby.
yeah. And that was, pretty much the surgeon said after he'd had to go and flush the wrist out and basically check post the golden staph infection. He said, I don't like your chances of working as an osteopath moving forward. Like this could impact, because pretty much my chance of risk of arthritis and everything else was through the roof based on everything. And so, it was a little bit of, I was, I still had a year and a half to go in the degree, that kind of baptism of fire, like, all right, well, I'm just about to invest 5 years of my life in a career that I might not be able to do. So that's another thing with the manual therapy and probably me getting pushed to learn more about the exercise therapy and prescription perspective is I just knew that I wouldn't be able to be a manual therapy osteopath for 30 years or 40 years because my wrist probably wouldn't make it. So that's my good wrist. That's as far as my other wrist moves.
Oh, Jesus, bro.
There's a good 45 degrees plus difference there.
So,
it's stuck.
Yeah. So that
just doesn't do it.
That's it. I get it. Extension's all right, so I can bench.
There's your front squat, bro.
But I can. Front squat.
Right.
Mobility is. Front rack's okay. But definitely it's impacted on other aspects, and I can, in my job that I do now, I can mark and all of that. But if I do any contact and tackling and things like that, pretty much my whole arm will shake and I'll have pain for kind of a week and that sort of thing. And you just, you work around those sorts of things. Try not to put my hand up for return to play tackling progressions when the guys are coming out of rehab. But every now and then you've got to take one for the team and just strap it up, take a few painkillers and we'll be right.
Off to go. I know a good osteo if you need help, mate.
Yeah.
But was there much because like you said, there was only 50 osteos when you first started registered in Queensland. Was there much sort of pushback or people that would maybe come to see you and they'd be like, oh, osteo, I want to see a physio?
Yeah, there was
a bit of that sort of stigma floating around.
Yeah, it was a bit of that. But the interesting one a lot of the time was, osteos ended up for a little bit there becoming the last resort. I've been to a physio, I've been to a chiro, they haven't been able to help me, so I thought I'd give osteo a go, or my friend told me to come see an osteo. So it was almost like you were the third cousin type scenario that I've done this and this, I suppose I'll go and give osteo a shot. And that's what it was like when I first graduated. It was just people weren't informed on what it was that we do, and osteo, all they think of is bone. So pretty much they were like, oh, so you just work with bones. And so it was, a strong educational component on, well, no, we actually, work on the neuromusculoskeletal system. So, we have techniques that work on joint manipulation and mobilization. We have techniques that work on the muscular system. And then we have techniques that I guess work on the neuromuscular and neuromodulation component as well. So I think, initially there was just a lack of education and information, and now osteopathy is much more understood. But I think also there's probably less difference between some physios and osteos now than probably what there was 10 years ago. And because there are a lot of osteopathic techniques that are taught in physiotherapy schools and chiropractic schools, just like there are physio techniques taught to osteopaths now. And
Yep.
so you're seeing a little bit more of, that unity across allied health practitioners, definitely.
Do you think that ever, this is just like a thought, do you ever think they'd come up with maybe a new name and you'd study a little bit longer, but you're all of them in one go?
I reckon they're
like you're picking up all these skills from everybody else.
It's called a wizard.
You are a wizard. That's where you're like the wizard high level being level.
I reckon that someone's tried that in America and tried to trademark it and that sort of thing. But
yep.
you'd never have a university or a college endorse something like
yep.
that. And that's the main component of people who study these degrees is
yep.
they want to know that it's been evidence informed. And the tricky component with osteopathic medicine and chiropractic to a degree and some physiotherapy techniques is there is still inconclusive evidence for some techniques that are used, and some people argue, oh well, that's just because you can't measure it, and or we don't understand the kind of underlying mechanisms that are occurring. But I also think that there's such a large component of the psychosocial that you can't measure, and there's a big difference between someone walking into my clinic to see me, and Johnny's basically said to this client, "Oh, Selwyn's phenomenal. Like, he helped me with my back." And so straight away there is an internal belief in that person walking into the clinic that I know my stuff and that they're going to get and right away they're probably already 15% better. Now the beauty of QSMC at the Gabba where Johnny came was then they go sit in the waiting room, and the waiting room there is pretty much glittered in Wallabies, jumpers, Brisbane Lions, Queensland Reds, all saying like, thanks to the practitioners at QSMC for getting me back on the park. So they're now sitting in the waiting room looking at all these images of professional athletes saying how good the practitioners are at QSMC, and like, shit, yeah, I'm in a good clinic. I'm 15% better again. So already they've walked into the clinic. I've not even met them, and they're 30% better. So really, I just need to, make sure I don't stuff up my diagnosis. And we're already on a winning path. So there's a big component of the psychosocial and the emotional attachment to pain, and there's plenty of evidence now around chronic pain and emotion and our belief systems that is linked and intertwined. And so I think how you measure that, I'm not too sure just yet. I know there are people, trying to better understand that. But I think that's one reason why you won't see kind of the different allied health practitioners or modalities like come together as one, because I think the underlying philosophies that you learn from that kind of starts your foundation, and then your personality and your philosophy will then probably determine which path you go down, and whether you become, I guess, more engaged in believing that manual therapy is the only way to help people, or whether you start to trend more towards the exercise prescription therapy component, because there definitely are a lot of practitioners out there who believe predominantly in manual therapy, and that's okay, because once again, I think the success in your treatment probably also depends on the self-belief of the practitioner. So if your self-belief is so elevated that you think that you've got the best manipulation techniques and muscle energy techniques than anyone else, then the client may actually get better as a result of that personal belief that you have as well.
And going back to, like, you talking about the emotional attachment to pain and things like the psychosomatic portion of it, have you ever met a client that you've done the assessment, like you've treated them, you've done your job completely, you have, and they're still in pain?
Yeah, definitely. Because especially when you're dealing with people who have had chronic pain, there's really diverse, I guess, influences in their pain. So I think with those sorts of clients, it's really important to inform them and educate, and that's where education becomes really important, because also the biology of the human can take time to change. So when you've been in pain for a long period of time, it's not going to be a quick change. And so for those types of clients, it's important about showing them small improvements. So that's where using key performance indicators or goals around their injury is really important. That is not associated to pain, because the problem with a lot of those clients is they associate a lot of their active daily living tasks or their day-to-day tasks with pain. So getting out of bed, oh yeah, my back hurts when I do that, or getting out of the car, yeah, my back. So all of a sudden there's lots of associations, and so their beliefs are, then they start to build beliefs, yeah, driving for long periods aren't good because it hurts when I get out of the car. And so all of a sudden there's fear associated with that, and then you start to develop these fear avoidance patterns. And so
how do you treat something like that?
Well, that's where trying to understand the underlying, I guess, mechanics and dynamics. So the mechanics being, how do they move, and is there something that you can change in their movement pattern, or educate them in their movement pattern, which will then change their association with the pain or with that type of scenario of getting out of the car and being sore. So do you change the pattern and then the dynamics associated with that? So let's say they always get out of their car and they swing one leg and then the other leg. Is it all right, you start to educate them on, let's pivot both legs out of the car at the same time, and you do a sit to stand type technique, like almost sitting out of a box squat. And so does that then become part of your movement strategy or your education strategy? And everyone's slightly different. For some people it might be it's getting out of a chair is what's associated for them. So then techniques I've used before is, all right, educating them about how to stand up from sitting, where they actually put their hands on their thighs and they load through their upper limb to stand up. So no longer, and what that also does is you push down on your thighs, straight away you're bracing. So a lot of people don't understand the internal advantages of bracing and making sure you create kind of rigidity and stiffness through the spine, kind of, unless you've put a heavy bar on your back. So some people would never have been taught that sort of philosophy. So it's amazing how just educating someone on creating, stiffness through their torso and bracing can be beneficial for those sorts of things. So it's about finding those little ins, and then it's all progression based. You think of it like when you're going to prescribe a new exercise to someone, you might need to break it down and regress it. It's the same with these sorts of KPIs or mini goals. You're going to have to break it down. So from sit to stand, all right, they can't do that where they just thrust themselves up with their lower body. So let's start with walk your hands down, make sure you weight transfer forward, and then from there it's push through the floor to stand up tall. And whether or not you need to talk to them about what they're doing with their hip hinge and that sort of component there, or whether that becomes a separate exercise, because pretty much that's standing from sitting is a combination of a squat hinge pretty much. And so do you need to educate them on that component away from the chair as well, because that's what they're fearful of.
I think one of my clients, we've had him on the podcast, Doc Paul, psychiatrist. He always said to me, he goes, Johnny, one of the big things that people don't understand with injury is not just the rehab of the physical side of it. It is the mental side that comes with that injury. And more often than not, that mental one can be worse and take longer to overcome. You come across that as well, yeah?
Yeah, definitely. You can have an athlete who goes through their entire rehab, ticks all the boxes, but it's still having that confidence in being able to execute, on game day or on the main stage. And that's the really important factor for what I do in kind of our reconditioning space and return to play or return to performance is you have certain criteria that they're trying to achieve along the way, which allows them to earn the right to progress in intensity or progress into a more chaotic environment. And so throughout the entire process, they see that progression, and you use that to try and change that mental, I guess, confidence and to build the confidence within themselves and within their body. Because I think if you don't educate them along that pathway, then their pain decreases, but they don't understand what they've also achieved while their pain's been decreased. So you can kind of get a decrease in pain, but they haven't seen the improve in function. Or you can actually get sometimes some athletes where pain stays stagnant, but function has improved drastically. So I understand that your pain is still a 4 out of 10, but your function, like you're doing this and this now, where last week you couldn't hop, or last week you couldn't jump forward, whereas now, so there's also that component, and so sometimes we can actually be fearful of pain, where we need to also understand that if we can improve function and pain stays the same, then we're actually progressing, and that can be just as powerful for an athlete as getting them out of pain.
Yeah. And do you find when you're rehabbing, because I mean, you obviously with Melbourne Demons playing with professional athletes, their job is to play and be on the field. Do you have to try and juggle that balance between their desire to want to get back and play and what is probably smarter around timeframes to get them back to play? Yeah,
definitely. There's always a balance in regards to, especially with the Demons at the moment, because we're winning games of football and we're performing really well. There's a motivation for everyone to want to play, but that's awesome because it makes our job easier. But then it also makes it even more important to have that criteria-based approach locked and everyone agreed upon, because you could have athletes who basically tell you they're better than what they are, and you naturally would progress them and accelerate their rehab, but they may not have ticked off a certain criteria that you think is really important. And so, our message to our athletes is you can progress as quickly as you can. We won't hold you back based on time, but you've got to make sure you hit these markers to earn the right to progress.
And I imagine that'd get them a bit competitive too, wouldn't it? With each, okay, cool, here's milestone 1. I know when I get this, I can get to 2, and there's only 1 more and I'm allowed to play. There's a big game in a week's time. Fucking 100%. Clamshells do I need to do to get there, or you know what I mean?
Yeah, 100%. And the beauty of our environment in the team sport environment is it's really unique, and you've got a heap of boys and men, lots of testosterone, and it's an enjoyable environment. So you've got that motivation as well to just want to be there with the team and take success. So getting them back training with the team can be really beneficial for that mental component as well.
Must feel good for you, bro, as well as the person getting that person back on the field. Like, let's just say it's a key player, someone who's integral in the game, and whatever you've done, plus to guide them, and they've obviously put in the work to get it, and then they get back and they play that game that weekend and they win. That must be a real buzz for you, bro, for your job.
Yeah, I think it's I'm really fortunate to do what I do and love what I do, but I very much see myself as just playing a role in making sure that the players own their own program. So definitely whether they're succeeding out on the field, I think is more so about how well they apply themselves in their reconditioning and in their training with the team. And while I take enjoyment out of seeing them succeed, I don't think it's necessarily because of me, but I like to see that our department play a really pivotal role in making sure all of our players are kind of as close to peak performance as frequently as possible. And I think that makes our jobs easy.
But as good as it is to get them back in the field, do you feel the pressure as the head of that department to make sure they're back on the field? Like, obviously it would be a good feeling, but there's got to be some pressure with that, especially if they are a key role.
coaching staff above you as well, probably.
Yeah,
we need him.
there is always, I guess, external pressure and those sorts of aspects. But, you know, our department with medical performance and coaching is, so collaborative and so supportive that you don't really feel that. And because, because the way that we develop our programs is everyone, even the athlete, has input into it, there's shared ownership. And so you never feel like, if something goes wrong, it's one person's fault. There's that shared decision-making, shared ownership around how we're going to progress them, how quickly we're going to progress, and when an athlete's going to return. And the coaches, you know, we try to get them involved in that where possible so that they can get skill development work into the athletes as soon as possible, because it's all well and good if we return their strength and their running capacity, but if their decision making and their ability to execute the skill has been something that we've lacked to train in a 4-week rehab, then they're going to return and they're just going to not be able to play their role for the team. So I don't feel, I guess I take a lot of pride in my work, and I'm a perfectionist, so I'll always put pressure on myself to deliver an elite program, no matter the athlete, no matter the time of year, and no matter whether we're winning or losing. But I don't necessarily feel the external pressure of if something goes wrong, it's Selwyn's fault, because we've got that collaborative approach, and we're always critiquing, could we have done something better, and how can we do it better?
I really like how you were saying then, like, obviously in an elite athlete setting, it's more prevalent. Like, they know their bodies, like they're an elite athlete for a reason, so they can have input. But a lot of the time, like, you know, your everyday gym goer, or, you know, your barbell enthusiast, they just look to your allied health to give them all the answers. But you should be able to know your body well enough to have that input. I really like it. That's fucking sick.
I think anyone who's just, let's call it amateur, hobbyist lifter or whatever, could take a lot and just have a bit more of an athlete mindset and accountability,
and then awareness and ownership. And I like that how you said, you it's an ownership. They take ownership because it is their body that they're working with.
Yeah, definitely.
How many guys, for someone who doesn't know anything about what would be going on with your role, let's say I've come to you and I've done my hamstring after a game, how many people are going to work with that person in that collaboration to get him back to play?
Yeah, so basically we'd have myself kind of leading like part of the development of that program in consultation with the sports scientist. So he'd be looking at their running loads, their max velocity, sprinting loads, game loads, and all of those factors to basically tell us what he needs to achieve to earn the right to play again, and what he typically would do in a week and in a game. Then you have the medical team. So we have 2 doctors and 3 physiotherapists. So, the doctors would be consulted on whether or not we need imaging or a scan, or if the physio medical department believes that the clinical assessment and presentation is not severe enough to warrant a scan, then the decision might be made in that medical department. No, we think that we don't need to get imaging for this athlete because they've presented strong. This is let's say the first time they've had a hamstring injury, and so then at the Demons, we've got a rehab physiotherapist. So some organisations with their 3 physios, they may not have someone who's aligned just with rehab. They may just have 3 physios where it's just a case management type scenario. So then one of those physios would lead, I guess, from the medical side, but we've got a rehab physio. So then him and myself would liaise around yes or no, we're going to image, and this is the time frame that we think that the athlete will be out for. And then we have a dietitian, so there'd be a consultation around whether or not we need any form of supplementation. The use of collagen is really powerful for tissue healing. So do we need to dose collagen prior to any of their rehabilitation sessions to assist with healing and repair? And then what does that look like if they're taking other supplementation as well? And then from there, like my boss, who's our high performance manager, we'd basically, inform him on kind of the time frame and the framework that we believe we'd return them in, and his strength is basically empowering us and in knowing what we know. So he'll provide feedback on whether or not he thinks we could do it quicker, or possibly what he feels we could focus on in certain parts of it. But then from there, it's kind of myself and the lead physio would take that and really drive the program. We also have a strength and power coach who would be part of the kind of development of then his strength program. So like my philosophy with some of those athletes who have a hamstring strain is their strength and power program would actually stay as aligned with the main group as possible, because most guys who have a low grade hamstring can still box back squat, they can still hip thrust, they can still trap bar. Like you don't need to change. A lot of the time you don't need to change their primary lift. So I actually see it as a awesome time to actually get more maximal strength exposure into them, because typically in season we need to pull back a little bit. And then it's really the hamstring specific loading that becomes, I guess the main manipulation within their program, but you're still trying to get your consistent loading of kind of quad calf adductor load through their other lifts, whether that be Bulgarians or lunges and things like that in our program. And so that would be kind of the main setup. And then we have, I guess, a sports psych and a welfare team as well, that if it's a substantial hamstring injury and we think they're going to be out for 6 to 8 weeks rather than the traditional 1 to 2, then they might be consulted on all right, what's the best way to set goals for this athlete? Are they an athlete who they want to see the entire 6 to 8 week time frame in front of them and know that criteria from day dot? Or some guys they want it in phase 1, phase 2, phase 3. So all right, what do I need to focus on for this period? And how I said before, like we don't necessarily rely on time. So rather than saying, oh, this is your 7-day focus or this is your next 2-day focus, it's all right, this is phase 1. The sooner you tick that off, bang, we're into phase 2. And so each guy's slightly different. And then, I would then liaise with their line coach. So if they're a midfielder, a forward or a back, I'd liaise with them on, all right, what's their strength, what's their growth, what skill development stuff can we hone in, how can we sharpen the sword, so if one of their growth areas is marking, how can we do extra marking with them while they're in rehab out of skills stuff in a closed environment, and then how do we progress that back into training as quickly as possible once they achieve their strength and running based markers.
Yep.
So that's how the plan's kind of mapped out, and
that's kind of cool, bro.
So, and then
by the sounds of it, man, you have a lot of data.
Yeah. Yep.
And you well, I actually heard a hot tip. You love data as well. Is something I heard.
Yeah.
Brandon coaches a guy who did. You may not remember him. He said some work experience under you at the Lions. Sam Harrison.
Sam Harrison. Yes, I do remember Sam.
Yeah. He's doing some S&C stuff with
UQ Rugby
these days. So I mentioned to him, he trains with us. I trained with him on a Wednesday with Brando. I was like, man, we got Selwyn on. I wonder if you knew him. He's like, yeah, fuck yeah, I do. But he said, man, ask him about data. He likes his data. But that sounds like that play a huge role in everything you're doing.
Yeah. So, if we use hamstring injuries as an example, we use equipment called the Nordboard, which is made by a company, Evolved Performance in Brizzy there. And so that gives us a profile of your hamstring eccentric strength. And so we have data on all of our guys from that perspective. But then we also do some monitoring around isometric strength as well, because, you have different qualities in muscles. And so we need to make sure that we are exposing the tissue to enough stress to adapt, but also to get enough information to know whether the athlete is back, within their normal bandwidth. So yeah, I'll tend to use previous athlete data to inform, where I need to get them to and what they need to achieve. So for a hammy injury, that would be NordBoard, that would be ISO numbers. It'd be chatting to the sports scientist around, all right, what's his GPS-based max velocity? What's his normal sprint exposure in a game? Because they're probably the two key factors that will increase your risk of re-injury, but also determine how quickly we can get a player back and making sure we're achieving those criteria. And then, we've got obviously wellness data and components on the players entering in, how they sleep, their energy, their leg heaviness, and those sorts of components. But then we also take data on some of the key strength lifts with the Gym Aware. So, you get your peak and mean velocities for some of our key barbell lifts. So it may also be making sure that from a performance perspective, because, any rehab and reconditioning, it's a performance model. It's not about rehab. It's about making sure that we improve the athlete. And so for certain athletes, it might be, like I said before, they need more max strength exposure. So it might be that you actually give them 2 max strength exposures across the week, but you use the Gym Aware to manipulate what zone they're training in. So are we training kind of more in that starting strength, or are we going into more speed strength or strength speed zones, and use the Gym Aware to quantify that and manipulate their sets and reps around their barbell velocity? Or we have force plates as well, where we could look at some of their jump data and make sure that we're testing components of power. Now, in a 2-week injury, you're not going to delve down as deep into those sorts of things, because in reality, in a 2-week injury, they may only be modified for 2 training sessions, and then they're back with the squad. And it's like, so you can't kind of change too much. But for a 6-week injury, you might have four of those 6 weeks where you can actually, change your strength exposure, your stimulus based off some of that data, and then use that to better inform how they're adapting to their program, and use that for your, I guess, informing them on, once again, other aspects outside of just their hamstring. So, if you can show them that they're getting stronger from
it's
their
got to be great for them mentally. Right?
Yeah, exactly. So
if it's a longer injury, like I imagine that gets guys down a fair bit. If they're like, cool, man, this is a bit busted up, but we're going to improve this, and this, as well as that in this time. So you come back and you're fucking better at everything. Like, that's got to really get them fucking snatching into everything, right? Yeah,
exactly. That's where trying to use that motivational interviewing in better understanding what drives them, what's their motivation, what's their purpose. What do they feel they need to get better at? You use that to inform that, and I'll manipulate their program based on achieving that where possible.
Now, something you touched on, and a couple of aspiring powerlifters here. It is nice to hear there are some barbells getting thrown around in that space down there. What could be done down there? Is there a back squat? Is there a bench press? Is there any deadlifting? Dare I say it's some Olympic lifting? It's a bit too complicated for 2 guys like us, but
fucking oath it is.
Is there any of that sort of stuff going on, or do you modify it a little bit?
No, we've got a strong belief in in maximal strength exposure, and our strength and power coach here, David Watts, he's a big man and can lift some impressive numbers, and so he's been really good for our group, and our group really value strength training, and that's been here before I got here, which is good. But so we box back squat, we trap bar deadlift, we RDL, we bench pull, we chin. We've got our big rocks in our program, and then from there we also make sure that we, I guess, continue to develop the movement profile of our athletes. So just making sure that they move as well as possible. But there's important components from having a good strength reserve that I think allows you to do more out on the field. And so it's the same with having a decent aerobic capacity. That's going to allow you to train more and train frequently. And the best injury reduction tool is training consistency. And so, having regular strength exposure and regular running exposure is going to be your best predictor of success. And that's going to allow for skill development as well, which is a key determinant in success in our sport. So, we get at least once a week a decent max strength exposure, depending on game day turnaround. We've got the sport and the skill is king. So I think, as well as strength and conditioning staff, you can't be too stubborn in, I need to get my big lift in this week. But, we need to also understand that these guys are running 12 to 16 Ks once a week. So, they're accumulating substantial volume. So if we go trying to max them out for 1 reppers in 6-day turnarounds, you got to understand that there's a component of neuromuscular fatigue that just accumulates, and it might not get them in that session, but it could be 2 or 3 days down the track that it does get them. And so you got to respect that that component. But so we don't do a huge amount of traditional barbell deadlift from the floor, but our RDL, glute ham raises are pretty consistent in the program, and then obviously the kind of bigger lifts, we've got a belt squat as well, which is really nice to use as a variation for some of our guys. So depending on guys with low backs and things like that. But you'll find pretty much everyone in our program will do some form of bilateral key lift, and then unilateral lift as well.
I bet and I imagine there'd be times when the lads would love to rip in, and a little bit of that testosterone starts running around, and you see some extra plates getting thrown on barbells here and there, and who's got the biggest fucking box squat starting becoming a conversation running around the club. Yeah,
and there's always a time and place for that, and we definitely encourage it when we can get it in the program. But that's the beauty of also the gym awares and using measuring some mean velocity and peak velocity, in that you can do it sub-maximally and get a pretty good correlation with whether or not their max strength is improving. So that's something that I think can be really valuable in our environment, where there might be a 6-week period where we don't get to kind of get a bit of a check on where their max strength is. But if we can track where their sub-max strength is, that can give us a pretty good idea of whether or not they're maintaining or losing strength in season.
Man, I got just a random question. What do you think of Nordics?
If they're,
do you like the Nordic? Are you for the Nordic?
I'm pro Nordic, I guess. I think anything that has shown to have a significant reduction in hamstring string injuries. I think it's and considering it's an easy exercise to implement, and it doesn't take high volume or a lot of time or equipment.
So I was gonna say, because you always hear about that one being real popular for a strength and conditioning space for people around hamstrings and trying to just look after those things.
And once again, it just comes down to having enough tissue resilience. So sprinting frequently and sprinting close to your max velocity is going to be more sport specific, and probably just as, if not more important than the Nordics. But the Nordics are there to apply an eccentric stimulus to allow you to continue to sprint and to continue to sprint frequently. So I think there's definitely value for them within a program.
Yep, they work. I am now trying to do Nordics myself. I'm on a quest to Nordic. I currently suck. I can do banded ones. So that's a pretty good start. That's my level of achievement at the moment. And I'm working my way down the bands.
Nice. I know. There's only one person I know who can do a full Nordic down and up. And he's a freak. He's a fucking demigod.
This is true. And I'm doing them after deadlifting, so I'm always fucking cooked.
Yeah, fair enough.
Bro, mate, we have for you 10 questions.
That's what I thought your question was.
That was my question. No, another question within the question. Man, I'm on a quest for Nordics. I've got all my clients doing Nordics at a powerlifting. I've said in 12 months, all of you fuckers are going to be able to do a Nordic, whether you like it or not. Everyone is going to be doing Nordics until you can Nordic. And it's such a cool word. Mate, but we do have 10 random questions for you. How they work is they're random. You think about the first thing that pops in your head, and there's 10 of them. Are you ready?
Let's go.
What word comes next? Apple, banana, house, ape.
Monkey.
Yes.
Yeah, fair.
Is that our first monkey?
Oh, that is our first one.
Is our first monkey. What motivates you to work hard?
Family.
Good answer.
Who is your hero?
My wife at the moment.
Lovely. Now, mate, you're celebrating the grand final. You guys have just crushed somebody and you've won it. You're on the celebration night and it's karaoke night to celebrate. What song are you singing when it's your chance to sing your song?
Wow.
Got to go big, bro. You've just won the grand final.
Yeah, it'll probably be a Blink-182 tune.
Ooh.
Yeah, it's probably something like All the Small Things or What's My Age Again. Just
fucking track.
really ripping out a classic.
It's gone big. No, that's nice, dude. What was your nickname as a junior?
Never really had one actually. Like pretty much just called Sel.
Sel.
All my brothers were called Griff, but I never got that.
You never got a Griff?
No, I never got a Griff. Yeah.
Damn.
So
how many pillows do you sleep with at night, sir?
One.
Whoa. Only one?
Yeah, why? Is it like an osteo reason, or is it just
is this a medical reason? Like, is there something we don't know? One is all we need.
Yeah, that's just me. Just one. Sleep on my stomach a lot, and that's all. Yeah.
Okay.
She's a pretty comfy pillow, though. We got some memory foam ones that are pretty elite.
Invested. Yeah, okay, maybe that's why we're at one.
You do you, man.
I'm still shopping at Kmart for pillow. How long does it take for you to get ready in the morning?
5 minutes.
Yes. Who was your first crush?
Oh, first crush. Are we talking celebrity or are we talking...
Either or, whoever you're prepared to share.
Yeah, Jennifer Alba.
Jennifer Alba, yes.
Yeah,
I'm down with that.
Trying to remember the TV show she was in when I was watching. But yeah, that was
I've definitely
epic.
Also crushed on her. Who knows you the best?
My wife.
Now, you have found a bottle on the beach. The beach holds a genie. You're rubbing the bottle. The genie pops out. You get 3 wishes. What are you wishing for?
Oh, a beach house in Byron Bay.
Lovely.
An endless supply of gin.
Oh, yeah. There we go.
And, geez, what else am I wishing for? The end of COVID.
Yeah.
Oh, fucking thank you.
I'm down for that one.
Yeah, jeez. No one said that yet.
Yeah. Yeah, why not? Get rid of that.
Because we're obviously not as intelligent.
Yeah, well, someone's pretty clever.
Man, it's been an absolute honor having you on the podcast. For anyone who wants to reach out, whether it be about work experience or just get in touch around injuries and all that sort of stuff, where can they find you?
I've got Instagram and Twitter. Instagram, I've got just my personal one, but you're probably better to follow my professional one, which is at Athletic Approach. So I've run a few courses and seminars in the last kind of 2 years through that, and have put out a little bit of, I guess, educational content on there. Probably not been overly useful lately on there. Haven't done much, but that's my Instagram, and then Twitter's at Selwyn Osteo. You can kind of follow me there. But if you're wanting to get in touch around anything to do with any questions about this show or other questions, then athleticapproach@outlook.com. Once again, I'll be running some seminars and workshops now that I'm based here in Melbourne. So awesome. Tends to be around accelerated reconditioning principles and certain just how I apply S&C principles within hamstring rehab, quad rehab, and those sorts of things. So
I just jumped on Instagram and followed them.
Sick.
Fucking pretty, yeah.
Super
I
cool,
will
bro.
put all those fucking links in the show notes so everyone can find you, man. Thank you so much.
No,
for
I
your time.
appreciate it. Thanks
Great to see you again, bro.
thanks for having me on, guys. Yeah, I look forward to catching up when I'm back in Brizzy.
Hell yeah.
Please
You can come
do,
to the
man.
pod cave. We'll do it, bro.
Yeah, sounds good. All right, guys. Have a great
Wicked.
day.
See you, bro.
Have a good one.
Yeah. Bye.